Absolutely. I take your word that don't give up. I think that's the key here. Because as you mentioned, Dr. Ahmed, there are lots of options available. And never think that doctors can't do anything. They can sit with you and they can go through the issues and the problems, and they always find something they can do to help you.
These are the three main goals that, the researchers now are focusing on. When we talk about cancer in general, we are talking about a category of diseases where there is abnormal growth of cells that's not controlled. And this kind of uncontrolled cell growth will cause a tumor. And that kind of cells, they have abnormal kind of shape and abnormal behavior and abnormal function to the extent that they can penetrate to the surrounding tissues, and they have the ability to spread to like far organs or distant organs from the site of the origin. So this is basically the description of cancer that we know of. When we talk about head and neck cancer specifically, we are talking about these types of tumors or abnormal growth of cells in certain parts of the head and neck that include like different parts of the head or different parts of the neck. I would say this is probably the basic like kind of definition and maybe the simplest way to describe it, unless Dr. Anwar might have a different like opinion about it.
No, I absolutely agree with you, and that is what I had in my mind. So you're absolutely right. Yeah, I'm quite happy to answer this one. So obviously, not all growths are cancers. Some of them can be benign, which means that they do not actually spread to the other parts of the body. And usually these growths, once removed, they lead to cure. So as Dr. Ahmed said, that if the cells have the ability to invade or to go into the structures around them, and also able to spread in other parts of the body, such as, for example, lymph glands elsewhere or bones, liver, lungs, then they are called cancers. And if they are not treated, then they can lead to quite serious consequences, including death. So that's the difference between cancerous lumps and non-cancerous lumps.
Yeah, perfect.
Excellent. If I may add to whatever have been mentioned by Dr. Anwar, which was nicely actually described here, we have, just to avoid any kind of panic there, as you said, or Dr. Anwar said, not every lump in the head or neck is considered like cancer. And to be honest with you, the vast majority of these are benign. So it doesn't cause the problems Dr. Anwar mentioned of spreading to different parts of the body or infiltrating to the surrounding tissues. So, but the other question that I may add to whatever you have just asked now, when to consider, if somebody, and I may ask my colleague Dr. Anwar, if somebody has like a lump in the neck or the head, when should he or she be concerned and should seek a medical advice?
Yeah, so Dr. Ahmed, I'm grateful to you that you mentioned that we can safely say that lumps are not cancerous. And that's why there's no need to panic. So if you discover an abnormality or a growth which has been there for a few days or a few weeks, the first thing is to seek medical advice. And it could be from your own general practitioner or an internal medicine clinician you have been seeing or are known to. And they can then take a detailed history and examine you properly. And if they think that this is nothing to worry about, because it could be infection, it could be inflammation, or it could be due to trauma or injury. So these lumps can be easily sort of managed and cured. So there's no need to panic. On the other hand, one has to be careful. If these growths don't go away within a couple of weeks, I would say, then you do need to seek specialist attention. We don't want to miss the opportunity, but even if they persist for more than 2 weeks, that does not necessarily mean that they are cancerous. They may still be benign and nothing to worry about, but it's better to check it out.
When we talk about the symptoms that might alert medical attention, the head and neck contains like several structures. We have, the ears, we have the nose, we have the mouth, and all the organs inside the mouth. So we can think about different varieties of symptoms that may alert or warrants like a medical attention. One of them, if somebody has a problem with his ears, like for example, pain or infection that persists, as Dr. Anwar said, maybe more than 2 weeks. This might need a medical kind of attention. It doesn't mean necessarily that he might have serious problem there, but needs to be checked out and to make sure that everything is fine. The same for the nose. If somebody has obstructed nose, especially with nasal bleed, this might alert some sort of attention that need to be checked out. In the mouth, any feeling of lump inside the mouth, or unhealed ulcer inside the mouth for more than 2 weeks or so needs also medical attention. In the neck area, you can think of any kind of lump in the neck or above this, what we call the chest bone, also needs or warrant medical attention and a medical checkup, just to make sure. Once again, these symptoms doesn't mean necessarily that someone has cancer, but it needs to be checked out to make sure that we are not missing a problem there.
Perfect.
You're absolutely right, Dr. Ahmed. I think that's very elegantly explained. So as you said, there are other structures inside the head region, like nose or back of the nose, ears, mouth, tongue, voice box, and back of the mouth. So most of the symptoms are either pain or lump or bleeding or problem with hearing, but there can be some other things as well. For example, if it affects the vocal cord, then people can have hoarseness of the voice, which means that their voice isn't quite normal. And if that is persistent, because that can happen with viral infections as well. So if it is persistent, then obviously that needs to be checked out. If they have a problem with the tongue and they can't swallow properly, or it hurts them, or if they have issues with the hearing or nasal blockage which is prolonged and doesn't go away, all these symptoms need to be checked out. There are some other sort of common symptoms which can be due to cancer and due to non-cancer reasons as well, such as pain itself and in any part of the head and neck area which is persistent. Similarly, some people have some tumors which have come from another part of the body to the head and neck area, and they can cause weight loss or high temperatures which are persistent. So these sort of symptoms do need to be looked at. So it is very important that we go back to what Dr. Ahmed and I have been saying, that if there are any symptoms, they don't necessarily mean cancer. So, but persistent symptoms should always be checked. So any symptoms, whether it's swelling, bleeding, discharge, pain, which doesn't go away after initial treatment by your general practitioner or by your regular doctor, then that needs to be checked. And if it's in the head and neck area, probably the best person, I'm sure you would agree with me, but I'll welcome your opinion on that. It should be an ENT doctor, which is or a head and neck doctor, we say, or sometimes it can be even a dentist if it involves any teeth or areas around that. And the most important thing from their point of view is a proper history. So they want to know about these symptoms, what sort of symptoms you have, for how long. So they have to take a detailed history of your symptoms. And then obviously carry out an examination, which is usually sort of looking at your ear, nose and throat area and your neck area. And sometimes the examination may involve using a tube with the camera at its end to have a good look in the deeper structures which we cannot see with the naked eye. So for example, looking at the back of your nose or in your back of your throat or even in your voice box. So sometimes they need those. And if there is anything suspicious, sometimes they take a little piece of tissue from it, either with a needle or with a scalpel. And that usually establishes the diagnosis, whether it's cancer or not.
Exactly.
Dr. Ahmed, if you would like to add.
Exactly. I would agree with Dr. Anwar. Absolutely what you have mentioned here about these symptoms and the diagnostic approach until we reach from history taking to physical assessment to even endoscopic, like direct visualization of the mouth and the throat and even the nose. And if there is any kind of abnormal, like I would say ulcer or mass, it can be checked out by taking what we call a biopsy to be checked out in the pathology and to confirm or rule out any possibility. With regard to the specialty, as we clearly said by Dr. Anwar, I mean, most of these symptoms like ear problems or nose problems or neck swelling can be checked out by ENT doctor, the ear, nose and throat doctor. On the other hand, if there is like something in the mouth, I think dental clinic would be the way to go. You never be wrong if you go to a family doctor. Family doctors usually are well trained to look after these symptoms, and if there is any kind of alarming sign, usually they will send or arrange consultation with the most appropriate service there. I have actually a story. One of my patients, actually, he started to have hoarseness of voice for almost 2 months duration. And he went actually to an ENT doctor who considered that it might be related to gastroesophageal reflux disease. And he gave the patient some sort of PPI medication to reduce the acidity of the stomach. Patient did not improve. And after several visits, he decided just to go to a nearby family doctor office, and she actually saw the patient and she said, you know what, I'm really concerned that you might have a problem deeper than this. I would suggest that you have to have a scope. And she referred the patient to another ENT, had a scope and diagnosed to have laryngeal cancer. Lucky enough, it was an early stage and he was treated and cured. So as I mentioned, head and neck or ENT doctors are a way to go. Dental doctors, for the mouth findings, and you never be wrong if you approach a good family doctor who can check out, and if there are concerning symptoms, he would refer to the appropriate service.
Fantastic story, Dr. Ahmed. As they say about it, that a very good family doctor is worth their weight in gold.
Yeah.
So nothing better than a good family doctor.
Once again, the staging, just to explain it to non-oncologists or medical doctors, staging meaning we want to know the extent of the disease, local extent, and distant kind of spread, or what we call if this disease has spread to different parts of the body. So how to do that? Number one, by physical examination. So if I have a patient where I suspect or already been diagnosed to have cancer after doing tissue diagnosis that have been suggested by Dr. Anwar. So I will examine his head and neck area. If I see some sort of swelling in his neck, I know that these lymph nodes might have been involved by cancer spread there. The other thing we do is we do imaging studies, something called CT scan, and more fancy kind of testing, some sort of nuclear scans called PET scan, which can show us exactly the extent of disease within the head and neck area, and if this disease has spread to other parts of the bodies, like the bones, the liver, and the lungs. So, and based on that, we can categorize the stage of this disease as early stage, or what we call stage 1 and 2. We have what we call locally advanced, which is stage 3, And we have the advanced, very advanced stages called stage 4, which includes those people who have disease spread in different parts of the body. And each stage of these different stages has different treatment approaches, because somebody might ask, what's the hell, why should we do all of this? Because each category or each stage of these kind of different stages has different treatment approaches that might include surgery, radiation, chemotherapy, immunotherapy, different modalities of treatment. So I don't know, Dr. Anwar,
elegantly explained, Dr. Ahmed. I haven't got much to add. The only thing I would say is very rarely, I think you probably meant to say that, but in the flow of things, that sometimes some clinicians may also want to do an MRI, which is a magnetic test as well.
That's true.
Rest is absolutely what you said. I think there isn't a sort of what you call it hard and fast terminology. People do use risk factors or etiological factors. So basically what they mean is that there are certain things which increase your risk of developing cancer. And while we are talking about head and neck cancer, there are certain things which, if people are exposed to, or if they do, they increase their risk of developing head and neck cancer. And I will just sort of go through some of them. Obviously, this is not the remit of this
head and neck cancer.
Yes. So, for example, smoking. We know that smoking does increase the risk of many cancers, but in head and neck cancer, so it's at least 5 times, I think it increases the risk. Similarly, alcohol intake increases the risk. And if somebody is taking both of them and using quite a lot of it, then that increases the risk very significantly, up to 30 times. So that is one area to look at. But that doesn't mean if somebody smokes, they will definitely get cancer. It only means that they have a lot higher risk of developing cancer of the head and neck area if they were not smokers. The other risk factors include some viral infections like EB virus, which increases the risk of nasopharyngeal cancer. Similarly, HPV virus, which increases the risk of oropharyngeal cancer, which is the cancer in the back of the throat. And then there are some sort of vague association with genetics in cancer. There are certain genetic conditions which do increase the risk, like I don't know whether to mention it here or not. I don't want to frighten people unnecessarily, but there are certain genetic conditions which increase the risk of developing cancer. Also some diets, especially fried foods and red meat, etc., salted and sort of foods can also increase the risk of developing cancer. Then there are associations with the family risk, because some families, some cancers can happen in the families. We don't know whether this is because those families are living in the same environmental conditions, are having same sort of foods, and also are exposed to same sort of viruses, whether this is the reason or something else. But all these are sort of possible risk factors. If somebody has any of these risk factors, they don't need to worry about it. What they need to think is what to do about it, because there are certain factors you have control over. And with help you can, for example, smoking. If somebody is a smoker and they're finding it difficult to get rid of it, there are sort of avenues of help. They can seek help and advice to quit smoking. Similarly, if someone takes alcohol and they need some help, so there are ways to sort of find help. But don't worry about it if you have any of these. You need to go and seek advice. I think we can talk about it later on, what sort of advice and which are the fora from where you can get those advice. So this is sort of in a nutshell some of those risk factors, and I'll ask Dr. Ahmed sort of fill in the gaps if I missed anything.
No, actually elegantly have been outlined by you, Dr. Anwar. I think we agree that the most important risk factors, the first like 3 or 4 mentioned by Dr. Anwar, alcohol, smoking, especially if combined together, the risk would be even much higher than using either of these risk factors individually. The Epstein-Barr virus, the HPV, are major risk factors, and some of them have mentioned the poor dental hygiene in general. In certain parts of the region, in general, they have some sort of habits of chewing, like tobacco or shamma, for example, in certain parts of the region. So these are also have been linked strongly to oral cavity cancers. So as Dr. Anwar said, these risk factor doesn't guarantee for sure that this guy or this woman will end up having cancer. But these risk factors will increase the risk significantly that you have to make some actions about them, and we're going to discuss it maybe in another section.
Thank you. I was thinking that about tobacco, smokeless tobacco, so you mentioned. Thank you for that.
To be honest with you, it's not among the top 10 kind of cancers. We have so many other cancers that are more frequent to be diagnosed that head and neck cancer. And this is good and bad in one way. Good because we don't see it that frequent, that's a good thing. But bad because might be overlooked. Okay, when somebody come to a clinic complaining of such a problem, and I'm pretty sure even Dr. Anwar might have seen this in his clinic, that so many patients, they come to the clinic, they would say, I have been visiting doctors over the last maybe 3, 4, or even 6 months till they reached the diagnosis, because people, they don't think about it. It's not like, for example, breast lump and breast cancer. Okay, most people and most doctors now are alerted about possibility of breast cancer with this regard. So it had been estimated globally to be around 3 to 5% globally. When we talk about Saudi Arabia, and we take all head and neck cancers combined, because we have different types of head and neck cancers, we can see clearly that they represent about 5.5% of all cancer that have been diagnosed in 2018. In 2018 specifically, there have been the most updated cancer registry report in Saudi Arabia, and in that year around 20,000 people, they have been diagnosed with different kind of cancers. And the head and neck cancers, they represent is almost 5.5%, meaning around 1,100 patients, they have been diagnosed with some sort of head and neck cancer, which is not a small number, unfortunately. It's not the biggest number, but again, it's not a small number. Globally, as I mentioned, is around 3 to 5%. Dr. Anwar, do you have
absolutely. You just
comment
put it
about
very
that?
nicely. I don't think I've got much to add on that. We know that generally speaking, cancers are more common as the age advances.
That's true.
Because there are more mutations taking place in these cells, and cells becoming more unstable. So we know that generally speaking, cancers are more common in elderly people. But the risk of cancer starts increasing from, I would say, 40 onwards. Seriously.
True.
And for some cancers, I was looking at some data from actually Saudi Arabia as well, and the risk of developing, for example, nasopharyngeal cancer between the ages of 40 to 60 is almost the same as from 60 onwards. So it is the age which is obviously higher the age, higher the risk. But that doesn't mean that younger people are completely immune to cancer. They can have, but they have low risk. And that's why sometimes it is missed in younger people, because younger people, when they have symptoms, doctors don't think about cancer, they think about other things. So one has to be a bit more vigilant with persistent symptoms, which we mentioned earlier, in younger people. In terms of sex, whether males have more risk or female more, there is a bit more risk for men. And that may be because of their habits, which we mentioned, some of the risk factors, like smoking, which is a lot more common in men than women. And there are other reasons as well. So yes, I think in terms of sex, it's a bit more common in men. It's in terms of age, it is more common in elderly people.
It might be, to be honest with you, different from one country to another, because some countries, they are more alert about head and neck cancer because of more frequent incidences in comparison to others. So if we go to the international data about the percentage of patients who are being diagnosed in early stage, is roughly 1/3 of those patients, like 30 to 35%. The other 1/3 is in the category of locally advanced, and the last 1/3 are in the metastatic phase. But ultimately, some of those who are being diagnosed non-metastatic at the beginning, some of them will have metastasis during, the following years of follow-up. We discover that have metastasis. So ultimately, we might end up having 50% of those patients are having metastatic disease, and we treat them as metastatic. Metastatic meaning those patients who have their cancer has spread to different organs or different parts of the body. So this underscores the importance of early diagnosis, and the chances of cure will be much higher if we diagnose in early stage in comparison to those who have locally advanced disease. Dr. Anwar?
Absolutely agree with you. And we know that at early stages, T1, T2 tumors, which means smaller than 2 centimeter or 5 centimeter tumors, basically, if you diagnose at that stage, then the chance of cure is very high, 70 to 80%. On the other hand, if it's advanced stage disease, the chance of cure goes down to as long as, I think, 20-25%. So it's very important. The whole purpose of this sort of meeting and discussion is for people to understand that although you don't need to worry about things, but if you have persistent symptoms, you must seek advice so that the diagnosis is made as soon as possible and treatment is started, which can be curative. Yeah, so there are other issues, because obviously head and neck cancers are quite special in the sense that the area of the body they affect, it can affect different functions of the person. For example, it can affect speaking, eating, swallowing, breathing, and also the appearance of the person. So when we are thinking of treating these patients, we, on one hand, we want to cure them. On the other hand, we want to make sure that they have as little suffering as possible. We also want to maintain what we call amongst medical profession quality of life of the person, so they can live for as long as possible, so prolongation of life on one hand, and secondly with as good a quality of life as possible, so that they can perform most of their daily life functions as much as possible.
Yeah, Dr.
Totally agree about whatever mentioned by Dr. Anwar, which was elegantly actually stated, that in those patients where cure is not possible because they presented with advanced stage, so once again, they shouldn't give up, because there are several treatment options that those patients that can receive, where it can maintain their quality of life like as good as possible, with the least like kind of symptoms they can suffer off, and they live as long as possible with these kind of treatments. Because some people, once they have been diagnosed with an advanced stage or advanced disease, they may lose hope that nobody can help me, that's an end of statement or end of life kind of statement or something like, which is not true. We have so many like treatment options that can be offered to those patients, which can maintain their quality of life. They can live as long as possible, and with the least symptoms to suffer from during this time. So this is the goal that we are looking at in these patients.
Absolutely, I take your word that don't give up. I think that's the key here, because as you mentioned, Dr. Ahmed, there are lots of options available, and never think that doctors can't do anything. They can sit with you and they can go through all the issues and the problems, and they always find something they can do to help you.
Yes.
So yes, I take your word for it. Don't give up. So I think you've already mentioned that, Dr. Ahmed, that the treatment can be in the form of different things. So the first thing is that treatment may differ from patient to patient based on the stage of the disease, the type of cancer, the site of cancer, the other comorbidities, which means if people have other health issues, so sometimes we have to modify treatment taking those things into account. And for most patients with early stage disease, cure is possible. Usually, again, in most cases, not all, but in most head and neck cancer, surgery is probably the mainstay of treatment in early stages of cancer. But this can be followed up by radiation treatment with or without chemotherapy. So that's usually the main. But in some cancers, surgery may not be the best option. And in those patients, sometimes radiotherapy combined with chemotherapy might be the best option to cure it. Similarly, in yet another group of patients where we think that surgery or radiotherapy is not the right way to start, they sometimes start on either chemotherapy or some other treatment, which obviously depends on their status and their other comorbidities. So treatment can be varied. And also in terms of systemic treatment, which means treatment we give either intravenously or very rarely orally by mouth, which go into the blood and then they can reach every part of the body. So if the cancer cells have spread anywhere else, they may still be killed by these treatments. And these treatments you mentioned, Dr. Ahmed, they include chemotherapy, they include immunotherapy and biological therapies like EGFR inhibitors, and yet more treatments on the horizon and in the process of going through the research. So yes, there are lots of options available in terms of treatment.
Excellent. If I may add to whatever have been mentioned by Dr. Anwar with regard to these complexity of treatment options, as mentioned by Dr. Anwar, it depends on the site, it depends on the size, it depends on the extent of disease spread. We have radiation surgery and we have different orders of using these treatment modalities. So how to approach each case? We have what we call the multidisciplinary rounds, where we sit from different specialties, like around the table, like we do right now. Like we have the head and neck surgeon, we have the radiation oncologist, we have the medical oncologists who use these systemic therapies we spoke about. We have the radiologists and pathologists and everybody who is really concerned about this cancer type. And we review every single case from, symptoms, from physical exam findings, from even the biopsy findings and the imaging studies. And we decide the best treatment approach with the best treatment sequence for every individual patient. So patients should be assured that whatever Dr. Anwar or myself or one of our colleagues will present with them, this is the treatment, the best treatment sequence for you, is not a one-person decision. Actually, it was a combined decision from different people in what we call the multidisciplinary tumor board or multidisciplinary rounds.
Fantastic. Thank you, Dr. Ahmed. I mean, obviously that means 2 brains better than 1. And obviously if you have 5 or 6 brains, that's even better.
Yeah, that's right. Yeah.
So, I think the most important things we have already mentioned. First of them is that awareness. So some sort of awareness that people should know, and they shouldn't be frightened, because a lot of people don't come forward. Some people actually know that there's something wrong going on and they're afraid because they either don't believe it's curable or they're reluctant, or they even face some sort of humiliation. I mean, they shouldn't feel like this. If somebody has persistent symptoms, they should come forward as soon as possible. So the second thing we mentioned is to remove the risk factors. So if somebody is smoking, or they take alcohol, or they have virus, or any other risk factors, so try to remove them to try to reduce their risk of developing cancer. Third thing is obviously early diagnosis. So they should seek advice for symptoms as soon as possible.
That's true.
So once that is done and they are treated, and then they can have discussion with their oncologist about the treatment options available. At the end of the day, we don't force any treatment on anyone. If someone thinks that if they went to hospital they will be given a treatment they don't like or they don't want, that would never happen. Because all these treatments are, even after discussion in our tumor boards, as Dr. Ahmed mentioned, we actually discuss all those options with the patients and their caregivers. And obviously whatever they agree with, then we go ahead with it. And last thing is obviously support. So support is very important, because as I mentioned earlier, these patients, they do have symptoms which can affect their speech or eating habits or their voice. So and also sometimes the disfigurement and stuff like that. So they need support from everybody, starting from their caregivers, their family, friends, health professionals and community on the whole, to support them, because not only the diagnosis is quite hard on everyone who suffers from this type of cancer, but also going through those quite strong treatments sometimes. Some treatments are not as strong, some can be quite strong treatments. So they do need a lot of support, physically as well as psychologically.
Yeah, I totally agree with Dr. Anwar. I want to overstate the point of the risk factors. We all heard about all the news about the sweetener, the aspartame, about it is a possible kind of carcinogen, and all people, they get panic of using aspartame on their like food or drinks or something like that, which is something I respect that. If you know that something, even if it's possible, maybe you need to avoid it. How about to tell you about definite carcinogens like smoking and alcohol? These are big carcinogens. I think if you want, like as a person, to really cut on the risk of, I wouldn't say only head and neck cancer, in so many other types of cancers, smoking and alcohol are the most important risk factor to work on, which I think needs from the individual himself, even from the people around him, to work hard on these factors to eliminate, to reduce that kind of risk, in addition to all what have been mentioned by Dr. Anwar from the support and during management and after the management and all these aspects. I wouldn't have a lot to add to that, which was well stated by Dr. Anwar.
Absolutely, and a couple of other things. I think, Dr. Ahmed, you would agree with me. You can't even remember how many people ask you about the sugar, how much sugar they can take, and whether they can eat meat or stuff like that. So I think the most important thing is that everything in moderation is the key.
Exactly.
So that doesn't mean that people should not take any sugary items at all, or they can't sort of eat sugar or sweet things, and they can't take any sort of fat or red meat. It's the moderation. So everything in moderation is okay.
Actually, I had a sad story about one of my patients. Actually, she was actually a metastatic breast cancer patient who was really depressed, and she was accompanied by her husband only. So the only visiting person is the husband, and I asked him, this patient might need a good family support, like why we don't see other people to visit her. He said all of her family, they don't visit her because of the risk of infection. Like they think that cancer is contagious, which is a big kind of misconception about cancer. It cannot be transmitted from one person to another, even with direct contact, shaking hands, even hugging the cancer patient. It doesn't transmit the cancer from one person to another. Another misconception about whatever mentioned by Dr. Anwar with regard to sugar, eating sugar, there is a misconception that just eating sugar, it will go directly to cancer cells and feed them, which is wrong. Moderation, use of sugar with moderation is not like something forbidden. You can use it with moderation, or even red meat or fat, it should be okay. One of the misconceptions is the cancer is a death sentence. And we see this kind of reaction with several of our patients. Whenever they have been told that you have cancer, all of them, they behave in a way that they have been told that you're gonna die, which is not true. Okay, we have very effective treatment strategies. Actually, my clinics, I think Dr. Anwar clinics is crowded with people who, alhamdulillah, have been treated and recovered from cancer completely for years, and just they come to the clinic to just say hi and to make sure everything is under control. So these are among the top maybe 3 misconceptions that I usually face. One of the actually problems that we face in our clinics, everybody will come to your clinic asking about this kind of herbal medicine. We heard that this herbal medicine will cure cancer, eliminate. And I have seen a video clip about a patient who actually used this kind of herbal medicine and have been cured. The message here that I want to send to people, be very careful taking these videos with grants. Because some people, yes, maybe he used this herbal medicine, but he was being treated in one of these tertiary cancer centers receiving chemotherapy, radiation, surgery. So he will keep telling people that I'm using this herbal medicine, but he's hiding or she's hiding the fact that she is receiving other treatments in big oncology centers, and this is why, after Allah will, she had been cured. So be very careful with these messages, because it's going to be dangerous if you just take them with grant. I don't know if Dr.
No, I entirely agree with you. And the problem is that when people come with these herbal medications, we don't really have good quality research backing them. So although, and it becomes very difficult for clinicians to say use it or not, because we go by the evidence, what has been proven by research, what works and what doesn't work. And it's always difficult for clinicians to tell patients, oh, you can't use this. Having said that, there are certain things we know that they cause harm. And in those cases, we do tell them, do not use this. For example, Habba Soda is a very sort of a famous example. A lot of people, while they're on chemotherapy or other treatments, they take Habba Soda, and that can affect their liver enzymes, so they go up and down. We don't know then whether it's the chemotherapy causing it or whether the cancer has spread to the liver. So that becomes a bit difficult. So we usually advise people not to take Habba Soda when they are having cancer treatment. So these sort of things, misconceptions are there as well. But most of the herbal medications are not backed by good quality research. These are anecdotes. Somebody said, oh, I was cured. Somebody told somebody, and they told somebody. So that is the difficulty we face. If there is good amount of research about herbal medications and it is available to general public and to the clinicians, then that's fine. But apart from that, we can only talk about the medicines and the treatments we know for sure about.
We have so many stories. I can speak till tomorrow, mentioning a lot of stories. But one of the cases in specific, since we're talking about head and neck cancer, I remember one actually like young, I would say boy, he was almost 14 years old when he was diagnosed with nasopharyngeal cancer. And at that time we decided, because it was locally advanced with big lymph nodes in the neck, so we decided to give him few cycles of chemotherapy. At that time TPF used to be the standard of care at that time, followed by the use of chemotherapy and radiation concurrently. So what happened, every time he got admitted to hospital to receive chemotherapy, please doctor, start chemo immediately. I want to start so I can be discharged as soon as possible. I asked why you're concerned to be discharged as soon as possible? Because I don't want to be absent from school. Okay, I want to go to school. You know, this is my last year. I want to get a high mark. And good enough, mashallah, he got cured from cancer. He submitted actually to medical school. He was graduated from medical school. And few years later, I received like a card, electronic card from his father, inviting me to his marriage. So, mashallah, tabarakallah, yani, he was doing fine during the whole years of medical school. And the message that I want to send out of this cancer, despite the fact he presented with a locally advanced disease to start with, but he was cured. And this didn't prevent him from pursuing his goal and his dream of being a doctor. He went to medical school, he was graduated, he got married, and he was following all these years, mashallah, in good health, mashallah, tabarakallah. So this is one of the good stories that I hope that, other people might hear about and might give them some hope.
Very nice.
At time of diagnosis.
Mashallah, he will become an oncologist.
I don't know about that, but definitely he was a doctor. Yeah.
And he would want to save more lives, inshallah. Yeah, very nice story, mashallah, very nice. I mean, mine probably isn't as good as yours, but I mean, I've got lots of them. But one patient who sticks in my mind is she was in her mid-30s and she had cancer which had spread, and in the head and neck area. And so she was treated with chemotherapy and then immunotherapy, the ilaj manai, you call it, I think. And she progressed on everything. And we were nearly hopeless when we started her on some biological treatment. And then she had such fantastic response that the whole cancer just sort of melted away and disappeared. And I think it's nearly 2 years on and she's still cancer free. Thank you very much.
Thank you
for inviting us.
Thank you.
It was a pleasant time. Thank you so much.
Thank you,
Doctor. Thank you very much.